You see a cat with a persistent scratch or maybe a little patch of irritated skin, and it's just so easy to think, oh, it's just a cat thing.
Right. It seems simple.
But actually, beneath that seemingly simple surface, there's this surprisingly intricate world of feline skin
Oh,
conditions.
absolutely.
So today, we're doing a deep dive into what often gets kind of lumped together under this big term, eosinophilic granuloma complex.
That's right. And that word complex, it's really it's doing some heavy lifting there because it's not just one single condition.
Oh, okay.
It's actually a set of distinct syndromes that, can look a bit similar on the surface.
Right.
So our mission here in this deep dive is to unpack these complexities using the information we've got and really clarify the specific issues involved. And understanding this is, well, it's vital for any cat owner, really.
And honestly, pretty fascinating for anyone just curious about how the body can react.
Right.
So our sources point to what? 4 main players in cats: eosinophilic plaque, eosinophilic granuloma, indolent ulcer, and allergic miliary dermatitis.
Mm-hmm. Those are the feline four.
Hmm.
And then we'll also touch on a separate, much rarer thing in dogs called eosinophilic granuloma in dogs, or EGD.
Okay. And I guess it makes sense why they get grouped together sometimes.
It does. I mean, they can share some clinical features. You might see similar sorts of skin lesions, and they can even pop up at the same time or come back again and again. Plus, a big one is that they often respond to corticosteroids.
Steroids, right.
But, and this is key, to really get what's going on and figure out how best to help the animal, we have to focus on the important differences between them.
Okay, let's get into it then. Let's unpack this. Starting with eosinophilic plaque in cats. What's the basic issue here?
Basically, eosinophilic plaque is a hypersensitivity reaction.
Hypersensitivity, like an allergy?
Pretty much. Think of it as the cat's immune system just, well, overreacting to something it's encountered.
Okay, and what kind of things usually set off this overreaction?
The most common culprits, insects, especially fleas, but also mosquitoes.
Ah, fleas again.
Always fleas. But the sources do say that less frequently it could be a reaction to something in their food or maybe environmental allergens.
So it can take a bit of detective work to figure out the trigger.
Definitely.
Interesting. And it's not just about the initial irritant, is it? I'm reading here that mechanical trauma can make it worse, and secondary bacterial infections are common too.
Yeah, exactly. The cat feels itchy, so what does it do?
Licks and scratches.
Right. And that licking and scratching can inflame the skin even more. It breaks down that protective barrier, and that lets bacteria move in and set up shop, causing more problems on top of the original one.
Right, okay. Now, if you were looking at a cat with this eosinophilic plaque, what would you actually see? Like, what's the visual?
Well, the appearance is often quite distinct. You'll typically see areas where the hair's gone alopecia and the skin is red, erythematous, and kind of eroded. These can develop into these really well-defined raised patches or plaques. They have pretty clear edges.
And where do these tend to show up?
The source material mentions common spots are like the groin area that's inguinal around the tail, the perineal region, the outer side of the thigh, also the belly, the ventral abdomen, and even in the armpits, the axillary regions.
It sounds really uncomfortable. And I'm reading they're often moist or glistening and can look striated, like lines. What causes that?
That linear look, the striations, that's a really strong sign of licking.
Oh.
The cat's tongue with its barbs creates those patterns as it just repeatedly goes over that inflamed area.
Yeah.
And the moistness, that suggests inflammation, maybe some fluid weeping from the skin.
And it sounds like it's not just a skin deep thing because the notes mention regional lymphadenopathy.
Yes, exactly. That just means the lymph nodes nearby, the ones draining that area of skin, get swollen.
Okay.
It's another sign the body's immune system is fired up and there's significant inflammation going on.
Got it. And finally, for eosinophilic plaque, is there a typical age? When does this usually show up in cats?
The info suggests it's most commonly diagnosed in cats that are, say, between 2 and 6 years old.
Okay, 2 to 6 years. Right. Let's move on then to eosinophilic granuloma. Now, this is where it gets maybe a bit more complicated because it affects both cats and dogs, but differently.
Absolutely. This is a key point. In cats, eosinophilic granuloma is one of those 4 syndromes we're talking about in the feline complex.
Right.
But it's also really important to know it happens as a separate condition in dogs, often called EGD, and it's actually less common in dogs. So same name, but potentially different things going on in the 2 species.
Okay, let's stick with cats for a minute then. What are the potential causes for eosinophilic granuloma in cats? Is it allergies again?
Similar to the plaque, yes, hypersensitivity is definitely thought to play a big role. But what's really interesting here is the hint of a possible genetic link.
Genetic. How so?
Well, the sources point towards a potential inherited problem in how some cats' bodies regulate eosinophils, those inflammatory cells we keep mentioning.
Ah, okay.
So it suggests some cats might just be genetically wired to be more susceptible to developing these granulomas.
So for some cats, it might be less about something outside triggering it and more about something inside, an internal predisposition.
That seems to be the implication, yes. Now, what's really crucial to grasp about feline eosinophilic granuloma is just how many different ways it can show up.
Oh,
Yeah, our sources lay out 5 possible presentations, and sometimes a cat might even have more than one type happening at the same time.
5 different ways.
Yeah.
Okay, let's hear them.
Okay, first there's what's called the linear granuloma.
Oh.
It often looks like a firm, raised, kind of line-shaped lesion. You typically find it on the back of the thigh.
A line. Okay, what's next?
Second, you can get these single or sometimes multiple raised plaques, and they can appear pretty much anywhere on the body. These often get ulcerated, break open, and they can have this characteristic rough, bumpy surface. The sources describe it as looking like cobblestone.
Cobblestone. Okay, I can picture that.
Yeah, and they might look whitish or yellowish, which can indicate some changes happening in the collagen within the skin.
Interesting. Okay, that's 2. What are the others?
Third, you can see noticeable swelling, particularly of the lips and chin. It can give the cat this sort of pouting look.
A pouting cat. Right.
Fourth, some cats, and this is apparently more common in younger ones, under 2 years old, they can get swelling and pain in their foot pads. It can even make them lame.
Ouch, poor things. And the 5th?
And fifth, eosinophilic granulomas can actually occur inside the mouth as ulcerations.
In the mouth. Whereabouts?
On the tongue, the roof of the mouth, the palate, or those arches at the back, the palatine arches. And this, as you can imagine, can cause problems like difficulty swallowing, really bad breath, and excessive drooling.
Wow, that sounds quite serious, especially that oral form. Is there any good news with feline eosinophilic granuloma? The notes mention something about spontaneous regression.
Yes, that's a really fascinating point, especially in younger cats, where that inherited form is suspected.
Uh-huh.
It is actually possible for the lesions to just resolve on their own, spontaneously disappear over time.
Really? Just go away by themselves?
It can happen, yes.
Well, that's certainly some hopeful news. Okay, let's switch gears now to dogs and EGD, eosinophilic granuloma in dogs. You said it's rarer and not part of a complex like in cats.
That's right. EGD in dogs is seen as its own distinct thing. And what's really striking here is the very strong link to specific breeds.
Oh, which breeds?
The Siberian Husky stands out significantly. The sources say they account for something like 76% of reported cases.
Wow, 76%, that's huge.
It really is. Cavalier King Charles Spaniels and possibly German Shepherds also seem to be more susceptible than other breeds. It points strongly towards a genetic factor in those breeds.
That really underscores the genetic component. What about age or sex? Does it affect certain dogs more?
Typically, EGD shows up in dogs under 3 years old, so relatively young dogs.
Okay.
And interestingly, it seems to be more common in male dogs. Around 72% of the reported cases are male.
So if you have a young male Siberian Husky with skin issues, EGD should definitely be on your vet's radar.
Absolutely. It's a strong possibility.
So what do these EGD lesions look like in dogs? Are they similar to the cat ones?
You typically see ulcerated plaques and also raised masses. They often have a dark or even kind of orange color.
Orange, yeah.
Yeah. And the most common spots are actually the tongue and those palatine arches at the back of the mouth. So that mirrors one of the ways it shows up in cats.
The oral form again.
Exactly. But dogs can, though less often, get skin lesions too, on their toes or digits, the prepuce, and on their flanks.
Okay.
And there's a little note specifically for Cavaliers and Cavalier King Charles Spaniels. The lesions might pop up on the soft palate or near the tonsils specifically.
Got it. And what do we know or suspect about the causes of EGD in dogs? Is it genetics again or allergies like in cats?
Well, the honest answer is the exact cause is often unknown, but in those breeds that are clearly predisposed, like the Husky, genetics are very strongly suspected.
Okay.
In dogs without that obvious genetic link, though, hypersensitivity and allergic type reaction, often thought to be triggered by insect bites, is frequently considered the likely cause.
Okay, so similar potential triggers as cats, but with that heavy genetic overlay in certain breeds.
Right.
Right, we've covered eosinophilic plaque and eosinophilic granuloma in both species now. Let's move to the third feline syndrome, the indolent ulcer. What's the rundown on this one?
Okay, indolent ulcer in cats. The potential causes, again, it seems like a mix of things might be involved. Both hypersensitivity reactions and genetic factors are suspected.
Okay, familiar themes.
Yes. And just like with the eosinophilic plaque, secondary bacterial infections popping up as a complication are pretty common.
Right. And what's the classic sign of these? Where do they usually appear and what do they look like? Is it distinctive?
It's very distinctive usually. The classic presentation is a single ulceration. It tends to be concave, meaning slightly sunken in, and feels firm or hard and indurated.
Okay.
And it typically has this kind of granular orange-yellow look, but the
Yeah.
location is key.
Location.
It's almost always specifically on the upper lips, right next to that little vertical groove in the middle, the philtrum. Very localized.
Wow, that's specific. Okay, that's a big clue then.
Yeah.
And how do these usually affect the cat? Do they seem painful or itchy?
This is interesting. The sources really emphasize that cats with these ulcers are rarely reported to be painful or itchy.
Really? An ulcer that doesn't hurt?
Apparently so, or at least they don't show obvious signs of pain or itchiness, which, can sometimes mean owners don't notice it right away.
I suppose so. Now, we've been talking a lot about eosinophils being central to the other conditions. What about here? Are they involved in indolent ulcers?
And this is a really critical difference. Eosinophil infiltration, lots of eosinophils showing up, is not a major feature of indolent ulcers.
Oh, okay.
Unlike the plaque, the granuloma, and the miliary dermatitis we'll get to. So the fact that eosinophils aren't the main cell type involved points towards, well, potentially different underlying mechanisms driving this particular lesion.
Okay, that is a really important distinction to keep in mind. And is there a particular age group of cats that tends to get indolent ulcers?
Based on the information we have, no specific age predisposition has been consistently reported for indolent ulcers. It seems like they can occur at various ages.
All right, good to know. That brings us to the last of the 4 feline syndromes. Allergic miliary dermatitis. The name itself sounds like it's an allergic skin thing.
That's exactly what it is. And it's described as a very common hypersensitivity reaction in cats.
Very common. And what's the usual trigger?
Number one trigger, by a long shot, is an allergy to flea bites. Flea allergy dermatitis is often presenting as miliary dermatitis.
Fleas, of course. It always comes back to fleas, doesn't it?
It so often does. A constant battle for many cat owners.
So what are the physical signs? If your cat has allergic miliary dermatitis, what are you looking for or feeling for?
Right, feeling is often key here. The hallmark is finding numerous small, firm bumps. They often feel crusty.
Like little scabs?
Kind of, yeah. They can be brownish or blackish, often surrounded by some redness. And like I said, you might actually feel these bumps more easily than you can see them, especially on a fluffy cat. And you'll likely see associated hair loss in the areas because the cat's been scratching so much.
Ah, okay. And where on the cat do these bumps typically show up?
The dorsum, that's the back, along the spine is the most common area.
Along the back. Got it. And unlike the indolent ulcer, is this one itchy?
Oh, absolutely. Allergic miliary dermatitis is typically associated with significant pruritus. That means intense itching. It really drives the cat to scratch, lick, and chew at themselves.
Okay, so really itchy cat, tiny crusty bumps, especially along the back. That's the picture for allergic miliary dermatitis.
That's the classic picture, yes.
And what about our friends, the eosinophils? Are they involved here too?
Yes, they are. Eosinophils are indeed a major type of inflammatory cell found within the skin lesions of allergic miliary dermatitis.
Okay.
So that further links it back to those other hypersensitivity-related feline syndromes, the plaque and the granuloma, where eosinophils are also key players.
Makes sense. And is there a typical age for this one to start?
Well, because it's usually an allergic response, and allergies often take time to develop after repeated exposure to the allergen.
Like repeated flea bites over time?
Exactly. So the typical age of onset is generally in cats older than 2 years.
Okay, usually over 2 years old. Right. So we've now walked through the 4 main feline syndromes and the separate dog condition, EGD. It's really clear there are overlaps, but also some really significant differences.
Definitely.
Let's maybe dig a bit deeper into what's happening, at a cellular level and how vets actually figure out which one is which. We've heard so much about eosinophils. What's their big picture role here?
Well, as we've kind of touched on, eosinophils are definitely key players in 3 of the 4 feline conditions. the plaque, the granuloma, and the miliary dermatitis.
Right, not the indolent ulcer.
Not typically the indolent ulcer, correct. These eosinophils, they're a type of white blood cell. Normally, you don't have huge numbers of them hanging around,
Uh-huh.
but their numbers increase dramatically in tissues affected by things like allergies or parasites or just general inflammation. So finding lots of them in these skin lesions really highlights the underlying allergic or inflammatory nature of these specific conditions.
Okay. So if a vet suspects one of these issues, how do they go about diagnosing it? What's the process?
It's really a multi-step approach. First off, are the clinical signs, what the lesions look like, where they are, the cat or dog's history, any other symptoms? That's crucial.
Makes sense.
But the source material really stresses that histopathology, that's taking a small biopsy, a sample of the affected skin, and looking at it under a microscope, is absolutely essential to get a definitive diagnosis.
So you need that biopsy to be sure.
To be really sure which syndrome it is, yes. And just to make things more fun, it's important to remember that sometimes a cat can actually have more than one of these syndromes going on at the same time.
Oh, great. That complicates things.
It certainly can make diagnosis a bit trickier, yeah.
So besides looking at the lesions and maybe doing a biopsy, are there specific tests or procedures that vets usually do?
Absolutely. Because hypersensitivity is such a common theme.
Right, the allergies.
Exactly. Implementing a really strict and thorough flea and ideally other insect control program is step one. That's critical both for diagnosis, seeing if things improve, and as part of the treatment itself.
Makes sense. What else?
Food elimination trials might be recommended. That's where you carefully change the diet, removing potential problem ingredients, and then reintroducing them one by one to see if a food allergy is involved.
Okay.
And then for figuring out environmental allergies, things like pollens or dust mites, intradermal skin testing is often considered the gold standard.
That's where they inject tiny amounts of allergens into the skin.
That's the one. It's generally seen as more reliable than blood tests for diagnosing environmental allergies in pets.
Okay. And you mentioned histopathology. The biopsy is crucial for telling these syndromes apart. Do pathologists look for specific things under the microscope?
Yes, they do. Each syndrome tends to have characteristic microscopic features. For example, with eosinophilic granuloma, they often look for these distinct areas where the eosinophils have kind of exploded, released their inflammatory contents.
Uh-huh.
Along with changes in the skin's collagen, sometimes they see structures called flame figures, which are associated with this eosinophil degranulation.
Flame figures. Okay.
Yeah. So each syndrome has its own microscopic signature, so to speak, that helps differentiate it.
So it's not just that eosinophils are there, but how they're behaving and what else is going on in the tissue. Are there other conditions that could maybe look like these that vets need to rule out?
Oh, yes, definitely. There's a whole list of differential diagnoses. For the feline complex, you have to think about things like skin issues caused by viruses like feline leukemia virus or feline immunodeficiency virus.
VLV and FAV, right.
Exactly. Also, autoimmune skin diseases like pemphigus foliaceus. Fungal infections could be ringworm, could be deeper fungal infections. Parasites like mange, specifically dermatitis, bacterial skin infections, pyoderma, and even, unfortunately, certain types of skin cancer.
That's quite a list for cats. What about for the dog EGD?
For EGD in dogs, the list includes things like other types of growths, or tumors, neoplasia, immune system disorders called histiocytosis, granulomas caused by infections or other non-infectious inflammatory processes, and even just plain trauma or injury.
So lots of possibilities to sift through. I guess blood tests might play a role in this whole workup too.
They can. A complete blood count, a CBC, might show a mild or moderate increase in the number of eosinophils circulating in the blood. That's called eosinophilia, which can support the idea that these cells are involved. And because, as we mentioned, Chun-Li LLV and FIV can sometimes cause itchy skin diseases in cats, testing for those viruses is often a good idea, especially if the cat is really pruritic.
Right. Okay, so getting the right diagnosis is clearly quite involved. Once you have that diagnosis, what are the usual treatment strategies and what's the long-term outlook?
Well, the absolute first and most important step in treatment is trying your best to identify and get rid of any underlying triggers or allergens.
So super strict flea control.
Absolutely paramount. Or making those dietary changes if a food allergy is suspected, or managing exposure to environmental allergens as much as possible. That's foundational.
Okay.
Then if there's a secondary bacterial infection, which is common.
Right, the ones that sneak in.
Yep. Antibiotics are needed. Things like cephalexin, amoxicillin globulin, or clindamycin are commonly used.
Okay. And we mentioned earlier that steroids often help. How are they used?
Corticosteroids, yeah. They can be given as an injection, like methylprednisolone, or
Okay.
as pills, like prednisolone, dexamethasone, or triamcinolone. They're very effective at quickly knocking down the inflammation and calming that overactive immune response.
So they provide quick relief.
They usually do. But it's important to note that if you use them repeatedly or for a long time, sometimes they can become less effective. That's called steroid tachyphylaxis.
Ah.
And they can have potential side effects too with long-term use. So because of that, especially for managing long-term environmental allergies or atopy,
Uh-huh.
allergen-specific immunotherapy allergy shots or drops. Basically, hyposensitization is often preferred as a longer-term strategy rather than relying solely on steroids.
Okay, so steroids for flare-ups or getting things under control, but maybe other options for the long haul. What other treatments might be used?
Yeah, there are several other medications vets might consider, especially if it's a chronic case or if steroids aren't a good option for that particular animal.
Like what?
Options include cyclosporine, which also modulates the immune system. Sometimes topical treatments like a cream with fluocinolone mixed with DMSO can be helpful for localized spots. Other drugs sometimes used include chlorambucil, maybe doxycycline in certain situations, alpha interferon, and magistral acetate.
Digestrol acetate.
Yeah, but that one comes with a big caution flag.
Oh, why is that?
It has a significant risk of pretty serious side effects, including potentially causing diabetes or mammary cancer in cats. So its use is generally really reserved for only the most severe cases that haven't responded to anything else. It's not a first-line choice at all.
Wow. Okay, good to know. What about treatments specifically for EGD in dogs? Is it different from cats?
For EGD in dogs, oral prednisolone, that steroid, is often the first thing tried, usually starting with a higher dose to get the inflammation down, then tapering it gradually to find the lowest dose that still works. In some cases, injecting steroids directly into the lesions, that's intralesional corticosteroids, can also be effective. And interestingly, the source material suggests that it's actually pretty common for dogs with EGD to eventually be able to stop treatment completely without the lesions coming back.
Oh, that's encouraging for dogs with EGD then. Now, with some of these drugs, especially the steroids and cyclosporine, are there important things owners and vets need to keep an eye on? Monitoring.
Oh, absolutely. When an animal is on corticosteroids or cyclosporine long-term, regular monitoring is really crucial.
What does that involve?
Typically, it means doing periodic blood tests like serum chemistry panels and checking urine samples urinalysis. This is to watch out for potential complications like the development of diabetes mellitus or making sure the bone marrow isn't being suppressed.
Right.
And for cats on cyclosporine specifically, sometimes measuring the actual level of the drug in the blood can help make sure the dose is right, not too high, not too low.
So it's really about managing the treatment safely alongside managing the condition itself.
Okay, finally then, what's the sort of expected long-term picture, the prognosis? Can these conditions be cured, or is it usually about ongoing management?
Well, if you're lucky enough to identify a specific underlying cause, like a particular food allergy, and you can completely eliminate it, then yes, it's possible for the lesions to resolve permanently. That's the ideal scenario.
But maybe not the most common one.
Probably not always. For many animals, these conditions tend to kind of wax and wane. You'll have periods where things are better, and then flare-ups, even with treatment.
Right.
So the goal of management is often to find the lowest possible dose of medication that keeps the lesions under control, or maybe even allows stopping meds for periods if possible.
Makes sense.
It's also worth remembering that point about cats with that suspected inherited form of eosinophilic granuloma. Their lesions might actually resolve spontaneously over several years.
Ah, yes, the disappearing act. Exactly.
Okay.
Whereas on the other hand, EGD lesions in dogs can sometimes be quite stubborn and challenging to treat effectively long-term. So the prognosis can vary quite a bit depending on the specific syndrome and the individual animal.
Well, this has been a really, really insightful deep dive into what gets called the eosinophilic granuloma complex. It's just so much clearer now that what looks like maybe one skin problem
Right.
is actually, especially in cats, this whole collection of distinct issues, each with its own, potential triggers, different ways it shows up. and needing potentially different treatment strategies.
That's absolutely the key takeaway. It's just so important for pet owners to understand that if their cat or dog is showing these kinds of skin problems, getting a proper veterinary examination and diagnosis is essential.
Yeah.
You really need that professional help to accurately tell these syndromes apart and figure out the best plan to get their animal feeling better.
And it really makes you think, doesn't it? Considering this complex interplay we've talked about between genetics and environmental factors in these conditions,
Yeah.
it kind of makes you wonder what other, maybe seemingly simple biological things might have similarly complicated, multi-layered causes going on underneath,
That's a great point.
not just in our pets, but maybe in ourselves too.
Yeah.
It definitely gives you a deeper appreciation for just how intricate the living world is and all the subtleties of health and disease.